A popular beauty treatment now comes with a warning about HIV risks. The Centers for Disease Control is sounding the alarm after 3 women were infected after getting vampire facials. Dr. Elizabeth Hushmand with the American Academy of Dermatology joins us live to talk more about it. Welcome to Houston's Morning Show.
Good morning. Thank you for having me, and thank you for covering this very important topic.
Well, it certainly sounds like it, and I feel like this probably became pretty well known years ago when Kim Kardashian was really into it. But what is the tie between a vampire facial and HIV?
So when you do a vampire facial, it is otherwise known as microneedling with the addition of PRP, which is platelet-rich plasma. That involves drawing the patient's blood, we centrifuge it, and then we use the growth factors. So it does involve blood products. That's why it's really critical to understand where you're going and that this is a medical procedure and it should be done in a medical setting.
I have actually covered this story before where a patient used their own blood. So it sounds like people are using blood that wasn't properly tested and used a donor's blood?
So I do believe that what happened in this situation is different. So ideally, when you go into a clinic, you will have your own blood drawn. That is then centrifuged, and we always use your own product, your blood product for you. The needling pen that we use has a tip that should be used one time for that individual and that individual only. Again, the blood product should only be for use. That's one of the benefits of this procedure, is that it is not someone else's blood or donor products. It should only be your own. In this case, investigations where there were unlabeled blood products stored in a refrigerator. Again, none of these things are the way that the protocol should be. There are FDA-cleared PRP kits, FDA-approved microneedling pens, and in a proper clinic, for example, how I handle this is every tube is labeled with your initials, your date of birth. We have one medical assistant handling only one patient's blood products. Everything is done very protocol stepwise to assure patient safety at all times. It's a very safe procedure if done in the appropriate setting.
Yeah, it sounds like you definitely, though, need to consider having that serious conversation, just making sure that your provider knows that you're on top of this and making sure how they follow protocol. What is your suggestion about anyone considering treatments as far as needles and blood products are concerned? Because even with Botox recently, we heard some concerns, and it made headlines after people were getting fake injections. Again, it sounds like you really need to go to somebody board certified.
I really think you need to do your due diligence. The American Academy of Dermatology is a great resource. How do you know who you're seeing? So for example, a board certified dermatologist, if you look them up, they should be FAAD, Fellow of the American Academy of Dermatology. That means that you did a specialty residency in the field of dermatology. Now, I do think that you want to ask a lot of questions and know who you're seeing. Ask the credentials of your provider. Are they an MD? Are they licensed in the state of Texas? What are their credentials? Someone who is legitimate would be more than happy to share with you if they're a plastic surgeon, dermatologist, what their credentials are, and you're more than welcome to ask, how many of these have you done before? Have you been trained? What tools are you using? What type of micropen are you using? What kit are you using? Because, by the way, there are a lot of medical spas, not to put down the medical spas, all of them, but you have to see what tools the people are using where you go, because there are products from overseas, Amazon, that I've seen patients not get good results. Luckily, they weren't harmed, but they're not getting optimal results. So my piece of advice, if it seems too good to be true, the pricing is just way too low. I wouldn't, this is not the time to budget. And again, be your own best advocate and ask questions. A reputable dermatologist or plastic surgeon will have no issue sharing with you the protocols, letting you know what type of pen, what type of kits they're using. Right. In fact, I like to show my patients what I'm using. I show them labels of their name, date of birth, confirm with them each and every time before we do the.
All right, Dr. Hushmand, such helpful and possibly life-saving information to share with our viewers. Thank you for taking time today from the American Academy of Dermatology. Great to chat.
Thank you for having me. Take care.